not enough intensivists to take care of all the critically ill patients in all the hospital ICUs in this country.
At the bedside, time is a critical element. 15 minutes can be a lifetime.
The enVision eICU offers a potential solution for understaffing, for care delivery, for systematic quality issues that may arise in the ICU.
Prior to the eICU, we were having telephone communications with the bedside nurse, verbal descriptions of what the patient was like, and making decisions. We now have intensivists watching a monitor who can actually see the patient.
They can see what you're looking at. They can zoom in on the camera. They can even read a 12-lead EKG. If I hold it up, and I've done that and said, here it is, you know. The whole point is, when we have a really, really sick patient in the ICU, we have to be there right by that patient. We don't really have time to go figure out who to call and call their answering service. Okay. So they do that for us.
Well, my main goal every day is to protect the patient and to assist the nurse at the bedside. The nurses today have a much more challenging role. The acuity of the patient continues to increase. We have a very high-level technical system, and we have a group of people behind the camera that are very knowledgeable and very educated.
We have an established cadre of board-certified and board-eligible intensivists and established critical care nursing staff with over 400 years cumulative experience that serve as a backup for the clinicians that are acting at the bedside to take care of these patients.
In any situation, the patient can be going along and his blood pressure, pulse rate, everything's going well. And then all of a sudden there's a sudden change. I can address that sudden change. One evening, I was opening the camera. Patient's ventilator was alarming. I had seen the sat drop, and the patient had a tracheostomy. His inner cannula that was attached to the breathing machine had come loose and was starting to pull out. So I was able to get the nurse in the room right away, and she was able to address the situation. Therefore, the patient did not become anoxic.
It makes such a difference. It makes a difference in saving lives. It's a safety net for the patients. It's a safety net for the hospital. The process is good.
Use of a systematic quality tool that looks at every patient every day for CMS and other measures that are important for quality of care. Rounds with the nursing staff. We do patient rounds every night. We try to set our patient goals for the shift and sort out all our problems, and it's just smooth as butter. We make a diligent effort to continue the care plans as established by the bedside practitioners during the day.
This has had a tremendously positive impact on the patient care as well as the physicians who were practicing during the daytime, because after working all day long, sometimes 14 hours, we would be able to leave the ICU in the hands of the eICU intensivist and then come back the next day and find that things had been cared for while we were not present in the ICU. After implementing the eICU, we were actually able to reduce the total numbers of beds that we needed to keep in service for critical care patients, because we were able to more efficiently manage them using a 24-hour intensivist model, whereas we had previously only an 8-hour intensivist model. The eICU intensivist and eICU nurses are part of our team, even though they are only virtual members. There's a lot of trust, there's a lot of teamwork, and that's what critical care is. When we're doing things like shock resuscitation, you don't have time to run in and out of the room and call the private attending at home at night and wake them up for every order. Things are happening really, really fast. You need someone who knows what to do and is there on the spot.
Charge the defibrillator 200 joules. Once everyone's stepped clear, go ahead and shock.
Shock. In this environment of high tech, we are able to still touch the patient, touch the family, and be shoulder to shoulder with the nurse at the bedside. Any hospital is looking for manning their ICU as best as they could possibly do for patient outcomes. I think this is a solution that they have to seriously look at. It's a wonderful system, and I love it.